I spoke about myopia today, particularly reflected on myopia as becoming the future biggest public health challenge this profession of optometry, ophthalmology, and others in eye care have ever faced. So I'm going to give you a sense of the prevalence, the problem of myopia in the world, reflect a bit on some of the interventions that are available, but talk again, more importantly towards the end, about what we can do to address this issue of myopia. There are 2 billion myopes in the world right now. By 2050, there'll be 5 billion myopes. That would be 50% of the world's population. What it does mean is that it's going to place an increased burden on our healthcare system. Many of us are seeing the enormity of the problem and are saying, well, there's not much we can do about it. But actually, on the contrary, I believe that we can achieve a hell of a lot if we work together to try and address myopia. Lots of people agree that if your child spends more than 2 hours outdoors, that is protective. We need to spread that message. Secondly, I think there are a lot of corrective measures that are there, and I think it's important for practitioners to be knowledgeable about it and offer parents the options of those things. Even though the technology is evolving, we need to start getting people into it as soon as possible. In order to address this crisis, we need a coordinated campaign. And so we launched a campaign called Our Children's Vision. It recognizes that 19 million children worldwide are vision impaired at the moment, meaning they can't function, not just needing glasses, but can't function. 90 to 95% of that is due to myopia. We find that children are spending much more time on iPads, on mobile phones. They're playing outdoors less. The whole world has moved to a near world. And I think unless that changes significantly, this trend is going to continue. Eventually, we have to get governments and the private sector, which means the individual practitioners, to be taking that responsibility. Because no amount of donor funds is going to be able to address these challenges that we face. And we think by doing that, we can provide services to 50 million children by 2020. We need to get governments involved in spreading that message and making that an integral part of the school system messaging. But what I like the most about what's happening, even though the news is bad, is the fact that every individual practitioner can make a difference. And in fact, no matter what organizations do, what professional associations do, if individual practitioners don't change their clinical practice, change their health promotion strategies, don't change the discourse with their patients, we will be in 2050 in a crisis in this world in terms of eye care.